Okay, I am Doug Freer. We've been asked to identify some of the bladder points near the bottom of the foot and in the lower leg. The bladder channel pathology really always deals with retention of urine, urenesis, so involuntary bladder issues mainly in children. Pain along the channel, so the channel runs from the eye all the way down the back, so eye problems, head problems, neck and back, all the way down the back of the legs, so pelvis, low back, knee, and ankle issues all will go with the bladder channel. The other aspect is, so mania or abnormal behavior is one of the aspects of the bladder channel. The points that are more distal, so bladder channel starting on the eye, distal points are going to have a stronger effect on the head and neck, and points on the head and neck will have more effect on the distal bladder. So if we take the skeleton first and we want to look at the points, so we have 67 at the distal toe, 66 at the phalanges, 65 is just at proximal to the fifth metatarsal, just underneath the bone, and then we're going to go into 64, 63, 62, 61 is directly below, and we're going to look at 60, which is, we find the highest point of the fibula at the distal end, and palpate between that and the Achilles, the deepest hole there. That's going to be our bladder 60. 59 is 3 chun exactly up from 60. So if we go on the foot here, so 64, here's the shaft of the fifth metatarsal. If I just go to the head, and just where the skin changes color, so just underneath this fifth metatarsal is going to be 65, and 64 is just coming up, and it's at the head of the fifth metatarsal, just where the tuberosity is there. So there's your 64. So 65, 64, 60, highest point of the lateral malleolus, Achilles in the gutter between. So you just come up and go into that hole. That's going to be bladder 60. 59, and we take the hand of the client, so it's 3 chun, so take my 3 fingers. So here is our bladder 59, which is going to be exactly 3 chun up from the lateral malleolus. So the direction of needle is just right underneath the metatarsal, so 65 and 64. 60 is in the hole, and 59 is following up. It's just 59 is directly superior 3 chun above 60. So we look at, so again, we look at function of these points. 64 is the shoe point of the channel. So the shoe point always is high energy for that channel and accumulation of energy in blood. So if we look at these distal points, so any of these points down here are in this part of the foot are going to treat mania, abnormal behavior, because the channel does it, and this is distal to the proximal part of the channel. The bladder 60, so all these channels, again, these points down here are going to help treat the mania because it's distal from the channel beginning. So any neck pain, headache, or shoulder pain, eye problems, these points will all have powerful, because these points down are in the mania and heat issues. So any kind of heat in the channel, these points down here are going to have an effect on that point, these ones in the lateral part of the foot. The Bladder 60, so these needles all can go perpendicular underneath the bone, 65 and 64, 0.3 to 0.8. 60 can be up to 1 chun, and you can either direct it exactly perpendicular or find kidney 3 and aim it towards kidney 3. And this is going to treat ankle issues. And as we come up into the leg, it's going to again treat the heat issues in the channel or pain in the channel any place. So again, your headache, stiff neck, 60, because it's a power point right at the foot of the mountains. It's a strong point in the Chinese. It's right at the ankle. Then it's going to have also going to affect the shoulder because of the second row of the bladder channel. Stop.